Dr. Hill, a bariatric surgeon with Live Healthy MD, and today we're going to talk about the gastric bypass. The gastric bypass is the second most commonly performed weight loss procedure. Weight loss surgeons have been doing this operation for over 40 years. The first bypass procedure was performed in the 1960s and began as an open procedure, meaning doctors would make a large incision in the abdomen to perform the surgery. Although the morbidity and mortality rates were low for these open bypass procedures, they resulted in more wound-related complications, such as infections. In the early 2000s, surgeons made the transition to performing the bypass and other bariatric procedures laparoscopically, which is the only surgical technique we use in our practice today. The gastric bypass is a result of dividing and stapling the stomach to create a smaller upper pouch about the size of an egg that is separate from the large main stomach. The operation also involves rerouting the intestines so that the main part of the stomach and the first part of the small intestine is bypassed. As a result, food and digestive juices will travel down separate limbs of intestines. This altered anatomy allows an individual to consume smaller portions due to a smaller stomach size, while also absorbing fewer calories as much as the intestines are bypassed. However, we also believe that there are more important mechanisms in play that will result in weight loss. We have seen that when food is prevented from touching the lining of the first part of the intestines, hormones that help regulate your metabolism are altered. This allows individuals to lose weight when it was previously not possible through other conscious means. Since the digestion process is altered with the gastric bypass, this can result in nutritional deficiencies. Therefore, it is critical to take your vitamins and supplements after bariatric surgery to prevent significant nutrient deficiencies. Also, the gastric bypass can cause dumping syndrome. Dumping syndrome is a result of eating high-sugar foods that move through the body too fast, resulting in loose bowel movements. This can be managed by eating a healthy diet. Like all surgical procedures, the gastric bypass does come with its risks. Major complications that could result in reoperation include internal bleeding, bowel leaks, or bowel obstruction. Other complications that would not require reoperation include blood clots in a leg, a pulmonary embolism, or ulcers. Although scary, these complications are rare and occur in less than 1% of our patients. Minor complications after surgery might also occur, such as wound infections, vomiting or nausea, acid reflux, also known as heartburn, or changes in the bowel habits such as constipation, bloating, or gas. These complications are also uncommon and can be managed fairly easily without further surgery. As a patient goes through our program, we will make sure that they fully understand all the potential risks associated with their procedure. The gastric bypass procedure takes about 1 hour to perform, and patients can expect to stay at the hospital for up to 48 hours after surgery. Depending on the type of work performed, patients will be able to return to work within 1 to 4 weeks from surgery. Patients who have gastric bypass surgery can expect to lose 70 to 75% of their excess body weight within the first year. About 75% of patients who undergo gastric bypass surgery are able to keep off at least 50% of their excess weight for 10 years or longer. Other benefits of gastric bypass surgery aside from weight loss include better health, and an improvement or resolution of serious health conditions, long-term cost savings as a result of reduced medical care, and an improvement in a patient's quality of life. Studies have shown that patients who have had bariatric surgery feel better and spend more time doing recreational and physical activities. Similarly, patients who have lost a significant amount of weight experience more self-confidence and are more likely to become more social. The gastric bypass is a highly effective bariatric procedure that can help patients achieve their weight goal. Despite this complicated nature of this procedure, it is reversible and is able to be revised as needed.